On behalf of the 11 members of the Public-Private Partnership Advisory Council to End Human Trafficking, it is my honor to introduce to you the individual who holds the highest office in our federal government to monitor and combat human trafficking, Ambassador at Large John Cotton Richmond. Prior to his appointment in 2018, Ambassador Richmond dedicated his career to the global battle of freedom from both an international and domestic perspective. He worked in India, pioneering international justice missions, anti-slavery work, regularly serving as an expert to the United Nations Working Group on Trafficking in Persons, as a federal prosecutor in the U.S. Department of Justice's Human Trafficking Prosecution Unit, and co-founding the Human Trafficking Institute that exists to decimate modern slavery at its source by holding traffickers accountable and ensuring survivors are treated with dignity and respect. Over the years, Ambassador Richmond has received many accolades and awards, including being named one of the Federal Prosecutors of the Year by the Federal Law Enforcement Foundation, receiving the David Allred Award for exceptional contributions to civil rights, as well as twice earning both the Department of Homeland Security's Outstanding Investigative Accomplishments and a Human Trafficking Award and the Department of Justice's Special Commendation Award. We are all very fortunate to have someone as knowledgeable, accomplished, experienced, and passionate about this very real and devastating issue to lead the United States global engagement and support the coordination of anti-trafficking efforts across the United States government. Please join me as Ambassador Richmond addresses us now. Thank you.
On behalf of the United States, I want to thank the members of the inaugural Public-Private Partnership Advisory Council for their leadership in the fight to end human trafficking. Established by the Trafficking Victims Protection Act of 2017, council members comprise representatives of the Academy as well as non-governmental organizations. They were appointed in December 2019 as well as January 2020. And in a very short period of time, the council has worked to provide valuable insight to the anti-trafficking movement, particularly from a grassroots perspective, and actionable recommendations to the federal government. This is the council's first report, and it will serve as a tool to inform decision-making and to ensure progress towards our collective goal of preventing this crime, protecting victims, and holding the traffickers who caused the crime accountable. This council advised the President's Interagency Task Force to monitor and combat trafficking in persons, a cabinet-level entity, which consists of 20 agencies across the federal government and is chaired by the Secretary of State. I'm deeply grateful to each member of the council. You've given of your time generously, and you've worked quickly and tirelessly amidst viruses and shutdowns while leading your own anti-trafficking efforts around the world. The council's recommendations demonstrate that continued strategic work between the public and private sectors is critical to ensuring freedom. Thank you for your insights and your recommendations, and we honor all your efforts.
Good morning. Hello, everyone. This is Senator Tim Scott filling in for my good friend Chuck Grassley. Please join me for praying with him and for him as he recovers from COVID-19. Also pray for every other American impacted negatively by this tragic virus. On behalf of my friend Chuck, I want to congratulate Iowan Teresa Lynn Davison of Cedar Rapids, who was appointed by President Trump to this Private-Public Partnership Advisory Council to end human trafficking. I want to recognize the entire council, every single one of you, and applaud you for all of your great efforts in helping to save lives from this evil. Thank you so much. Your prevention recommendations call on the Department of Education and Health and Human Services to strengthen prevention education in schools and recommends the establishment of a prevention working group. These are really strong recommendations. You also ask that departments of Justice and Homeland Security and the FBI enhance anti-demand training efforts. You are not only focused on prevention, you are also helping survivors. You call for more data collection across the federal landscape and requests the elimination of victim barriers to financial restoration and legal status, while also improving identification and services for male trafficked victims. Great recommendations. Thank you so much for caring about people. There's a great scripture that says, stand up for those who cannot stand up for themselves, and you're doing just that. Even in the midst of this global pandemic, your efforts to save lives are having a major impact. I cannot say thank you enough. God bless. Have a great day.
Hello, my name is Bella Hunake, and I am a member of the United States Advisory Council on Human Trafficking. The Council, pursuant to Section 115 of the Justice for Victims of Trafficking Act of 2015, is composed solely of survivors of human trafficking representing both labor and sex trafficking survivors. As a survivor leader, it brings me hope to witness advocacy on behalf of survivors of trafficking from all sectors, and especially from the Public-Private Partnership Advisory Council to End Human Trafficking. This summer, the U.S. Advisory Council met with the PPP Advisory Council to better understand how we can together promote and enhance federal agencies' anti-trafficking efforts. I have also interacted with individual members of the PPP Advisory Council, including Diana Mao, Linda Smith, Dr. Sandra Morgan, and Teresa Davidson. Each has shown how passionate and dedicated they are to improving policies and laws on behalf of survivors everywhere. The U.S. Advisory Council recognizes the importance of collaboration and the collective work of the PPP Advisory Council. The two councils stand together on key issues. Both councils support prevention education for at-risk individuals and families to reduce victimization. Specifically, the U.S. Advisory Council believes that prevention efforts must address underlying factors such as homelessness for youth and providing meaningful support for youth in shelters. Both councils stand against criminalization of trafficking victims. We continue to urge PIF agencies to ensure victims have access to quality legal services, as they are crucial in addressing the long-term needs of survivors. We both believe that efforts to address the long-term needs of survivors must also include remedies for financial harms and restoration. On behalf of the U.S. Advisory Council, we thank you for engaging survivors. We hope to continue the fight against human trafficking with you through communication, representation, and collaboration. Thank you.
We want to thank you so much for lending your voice and your insight to our advisory council. We learned so much from you, and you truly are a fierce advocate. I'd like to introduce issue number 1 in our 2020 annual report. This issue is about prevention education for at-risk individuals and families that can really prevent human trafficking. So here's the problem as we see it. There have been very inconsistent efforts across our nation in the K through 12 landscape. And many times that's related to the economic status of that area. And we know socioeconomic status is a contributing risk factor. So we want to have materials for prevention that are best practice available to any school district, whether it's in a high-income area or a low-income area. We also need evidence-based programs. We don't want programs that are modeled after DARE, where we see that the effort to end drugs use by adolescents didn't actually happen. So we want better best practices that are peer-to-peer, strength-based models. So here are the recommendations that we've made. We want the Department of Education to develop classroom-ready human trafficking modules that are age appropriate and integrate existing prevention strategies and look at the overlap risk factors. Our education department should prioritize funding. We understand that's not happening right now, so we want Congress to provide funding for this kind of universal curriculum to be available. We want to develop and fund education and prevention clubs by developing opportunities for public-private partnerships. Specifically, we would also like the Senior Policy Operating Group to develop a prevention working group. We need to evaluate all of the educational materials that are siloed. As you'll notice in the report, many of the interagency task force have prevention programs. So we want a common effort to evaluate those. And finally, we stand with the U.S. Advisory Council on the following recommendation from its 2019 report. Department of Homeland Security, Blue Campaign, Department of Justice, Office for Victims of Crime, Health and Human Services, and the Office for Trafficking in Persons. We want to enhance public awareness materials and incentives by increasing coordination with survivor leaders and marketing experts to better reach our youth populations who may be underreporting trafficking.
Thank you, Sandy. One of the issues our report focused on in prevention was addressing underlying factors in youth homelessness. Knowing the toll extreme trauma takes on people victimized by human trafficking, I think we all can agree. Prevention is key. But where do we start? While issue 6 in our report calls for more research and data collection, there are existing studies that show key populations most vulnerable to become sex trafficked. Traffickers are targeting our youth, especially those who have run away or are homeless. They are taking advantage of these kids' most basic needs of shelter, food, protection, even love. Again, we ask, where do we start? If we look at 2 groundbreaking studies of Covenant House youth, children who define as LGBTQ and those who have experienced physical or sexual abuse are among the largest populations running away or leaving their homes without a choice. Of the 911 brave youth interviewed, almost 27% of those identifying as LGBTQ reported they had been trafficked for sex. Of the youth interviewed that were trafficked for sex, 95% reported being abused physically or sexually. When these children were asked what could have prevented them from becoming trafficked, the most common response was having supportive parents or family members. Bruce Perry, a prominent child psychologist, agrees. He found even having just one adult in a child's life who understood that their behavior was likely a result of trauma or fear and invested in them could make all the difference in the world in that child's life. In order to prevent human trafficking and its sequelae, we must begin with identifying youth at risk and provide services to increase their resilience to traffickers. Various government agencies are doing important prevention work. One beautiful example of this is the Bureau of Indian Affairs Office of Justice Services Victim Assistance Program. Within this program, personnel are required to actively participate on multidisciplinary teams that identify victims and provide their expertise in areas of victim services. One of this council's recommendations is for the Department of Justice to develop training on responding to at-risk youth and include it in the Human Trafficking Task Force e-guide resource. We have such a task force in Polk County, Iowa. Members of this task force effectively become that adult in the child's life I mentioned before. One survivor stated, "I could have been a statistic. Instead, my Department of Human Services workers saw me as more than just a case. I am thankful for the people on this task force that took a chance on me and helped me become not that statistic. This council recommends Congress develop funding for more of these important task forces, as well as provide meaningful support for youth shelters. This council recommends the Department of Justice track federal task force community mobilization efforts that identify the scope of local issues, stakeholders, and include identifying existing assets that promote public-private partnerships. And finally, we stand with the U.S. Advisory Council in all their previous recommendations to increase services to underserved populations. Thank you.
Thank you, Teresa. Issue number 7, preventing the criminalization of trafficking victims and ensuring access to quality legal services are critical to the long-term needs of survivors. So the issue is there is a lack of specialized services for victims and survivors in court systems. Court-appointed lawyers in every jurisdiction help defendants who cannot afford their own lawyer. However, these lawyers work with over 100 defendants charged with petty theft to murder. Human trafficking survivors need specialized legal care, a lawyer who will deep dive into their cases, a lawyer who knows the intersection between victim-offender victim cycle, a lawyer who knows federal and state trafficking laws and specific rights of human trafficking victims. There are few alternative program models specifically designed to help human trafficking victims. They are caught in victim-offender intersectionality. There are alternatives to prison available for women or people with drug addiction. However, without addressing the whole of the trauma boiling over in a trafficking victim, these programs will fall short. There is no such thing as an ideal victim in human trafficking. The harms of criminalizing trafficking victims have particularly egregious impact on child victims, especially when children are charged with a prostitution-related offense. Ideal victim, and they are often not to seek help, they will not seek help or identify as a victim and may be uncooperative with services. So as a council, we are recommending that the Department of Justice and OVC would provide funding for NGOs who advocate for alternatives to incarceration, that the Department of Justice, DHS, and HHS would collaborate with state attorney general offices, and they will regulate services in uniform broad-based training, that the Department of Justice and DHS and FBI would require this training for federal law enforcement and prevent the criminalization of trafficked survivors. HHS Administration for Children and Families would develop best practice protocols to create proactive aftercare solutions for children who are found to be commercially sexually exploited. As the Congress, we recommend to provide quality legal care and services for victims and survivors and funding local organizations. For grant funding to pay legal services for victims that address the impact of criminalization and expand the types of crimes and fees that are included in the Crimes Victim Fund that support victim services. Thank you.
Thank you, Kristen. The journey to freedom for victims of human trafficking in the US can be difficult and long, especially when they don't have income. I've met survivors of human trafficking who cannot even afford a Metro card in New York City and rely on food pantries to meet their basic needs. Others have expressed the challenges of having to take multiple buses and endure a 5-hour round-trip commute to get to and from work. Survivors lack stable employment opportunities, and simultaneously, employers are not equipped to provide the support needed when hiring survivors. Therefore, some are caught in the vicious cycle of poverty and at risk of being re-trafficked. You can see on the chart the major barriers to employment that victims of human trafficking face at each phase of the employment cycle, from job readiness to job retention. Organizations in the United States assist women to address these barriers to work. Some provide training, and others also help women secure their first job. Many of these organizations are represented on this council. In our report, we highlight some critical and urgent challenges that prevent survivors from securing safe employment and reduce their risk of being human trafficked again. Victims face major barriers at every stage of their employment journey, and without economic security, victims are re-victimized and caught up in the vicious cycle of human trafficking again. Victims who are concerned about their immigration status are particularly vulnerable, as they are not able to apply for jobs or fearful of being deported back into their country. Long wait for approval of T visa for foreign national victims, and without work authorization, they're unable to work. As well as law enforcement agencies sometimes fail to understand victims who have language barriers and treat them as criminals as opposed to survivors. Complicated and lengthy processes for victims to obtain continued presence also makes it difficult for victims to apply and obtain stable income and their job. The Council recommends that DHS and USCIS reduce the number of pending T visa cases by adding additional resources like staffing and training for more complicated cases to understand the impact of trauma on survivors, and also to continue to fund the Vermont Service Center where T and U visas are adjudicated. We also recommend that DHS consider funding nonprofit organizations to provide trauma-informed training to frontline employees at these respective agencies. In addition, we recommend that DHS and USCIS provide work permit exemption for foreign national victims immediately upon identification as a victim of human trafficking. And DHS and ICE trains federal, state, and local law enforcement agencies on when the minimum criteria is for continued presence is met by the reporting of trafficking victims, and encouraging them to initiate the protocol as soon as possible in this process. We also encourage that DHS encourages local agencies to partner with their federal counterparts to apply for continued presence for victims that qualify.
Thank you, Diana. Not only do many survivors face work barriers, but also many survivors of human trafficking report their traffickers exploited them financially, as well as physically, sexually, emotionally, and spiritually. In Iowa, Chains Interrupted has worked with a survivor named Debbie. Her name has changed and some of the details have changed for security purposes, but I just really want to take the time right now to thank Debbie publicly for her bravery in giving me permission to tell these parts of her story. When Debbie escaped her trafficker, her credit was destroyed and she was left with more than $25,000 in debt. Her trafficker had forced her to obtain a loan and then partially paid it off by exploiting her. He coerced her into obtaining credit cards by threatening her family, then made illegal purchases on them. Debbie's sole desire is to help other girls and women in trafficking situations, but without good credit, she is unable to obtain a bank account, employment, housing, a car, or even a cell phone. A local advocacy agency has hired her and has assisted her with housing, but this significant debt and poor credit is causing her great difficulty moving forward with her life. Importantly, Debbie has stated she has thought about performing commercial sex acts to pay off the debt, as she compares the amount of money that exchanged hands in that life versus her current paychecks. While there are public and private initiatives and programs that help survivors obtain bank accounts, debit cards, credit cards, and employment, The survivor's credit history remains scarred, and debt moratorium prolongs the problem. Restitution can help survivors pay off debt incurred during their trafficking experience. Our council recommends the Department of Justice increase training for prosecutors and victim advocates on requesting, substantiating, and pursuing restitution orders on behalf of trafficking survivors. We also stand with the U.S. Advisory Council in their recommendation for the Department of Labor to eliminate various barriers in their employment assistance programs. Some grants, including those from the Department of Justice Office for Victims of Crime, are available to assist survivors with financial resources. And while appreciated, the rules of the grant prohibit the monies from being used to pay for certain things, including debt reduction. Our council recommends Congress authorize the Office for Victims of Crime to include assisting with debt relief as a service in the list of those eligible for coverage by the Victims of Crime Assistance Funds. And because trauma-informed care is such a big topic, we included 2 stakeholders in our report: medical personnel and survivor restoration programs.
Thank you, Teresa. People who have been victimized by human trafficking have likely experienced trauma in most, if not every, category of the social ecological model. The effects of this trauma are complex, far-reaching, and affect survivors' lives in every aspect. 64% stated that they had accessed healthcare services at least one time during their trafficking experience, and 96.7% of those survivors have indicated they were not asked questions about their trafficking situation nor provided resources. There's a lack of training for frontline medical professionals that is evident in these statistics. Our council recommends that HHS continues their initiative to create core competencies for human trafficking for the healthcare professional, and also that HHS considers adding internal and external response team recommendations and training as options to the core competencies, as well as the SOAR modules available for healthcare professionals. Finally, we stand with the U.S. Advisory Council and their recommendation in their 2016 report that all PITF agencies' public awareness and outreach be trauma informed. We also stand with the USAC in their recommendation in regards to DOJ, HHS, DOS, USAID, and DLL to provide comprehensive services for all survivors of human trafficking. Our recommendations to Congress include providing a robust funding for human trafficking survivors, including funding to enhance services that are already offered by direct service providers. In addition to creating funding streams through HHS and/or OVC to create specific anti-human trafficking programs within healthcare organizations. Thank you, and now I'm going to turn the time over to Sandra Morgan.
On behalf of all 11 members of the Advisory Council, I want to thank you for joining us today for the release of our inaugural report. As representatives of the private sector, as academics, as nonprofit leaders, we have been grateful for the opportunity to bring our experience and expertise along with our community resources and relationships to partner with our government to combat human trafficking. The Council, should it be reauthorized by Congress, will need to address the gaps in our inaugural report to focus on labor trafficking, on sustainable housing for survivors, and on the rapid changes occurring due to the pandemic, as well as building stronger private sector collaboration regionally across our nation. As the anti-human trafficking movement matures, I look to the example of William Wilberforce, who has inspired me by his example of collaboration, intentionally building overlapping networks with academics, corporate leaders, legislators, public sector leaders, faith-based leaders, and nonprofit leaders. While this council has ended, our newly connected networks will add more strands to the safety net to promote prevention and to care well for survivors. We want you to read all of the recommendations. Take them into consideration. See where you can be part of this movement going forward. To find the report, please go to www.state.gov/Public-Private Partnership Advisory Council to End Human Trafficking. Thank you.